TJ Partners is an LLC corporation. Who are its members?
I can't answer that.
I'm sorry, I can't answer that.
Good question, deserves an answer.
And you guys can get that answer if you get on those committees and help us with that.
This one may be the same. Does TJ Samson Articles allow it to be in any business it desires? They could take their laundry service business out to the public, much like the way they have their pharmacy.
I think that's a good point.
Pass that along. Is there a viable future for physicians who do not choose to be hospital employees?
Boy, I tell you, I would like to jump on that just a little bit. Just to kind of give you a little bit of a flavor of what it's been like to be a cardiologist in this community for the last couple of years, I want to explain it to you. We had a very close, cohesive group of cardiologists here for the last few years. I mean, Jim Whiteside has been here for, gosh, I guess 30-something years. I've been here for 22 years. Dr. McConaughey has been here for 14, 15 years, I think. Together, the three of us, we champion primary PCI. You can have an angioplasty now that you couldn't have here before. Dr. Whiteside and I opened the cath lab in 1991, cath without a net for many years. We've done in that cath lab thousands of cardiac catheterization procedures. I can speak for myself. I know I've done about 5,000 in the last 20 years, and our complication rate together with us three was less than 1%. We thought that we were delivering a good product to our community. We enjoyed it, we loved it, we loved each other, we were cohesive. But our local hospital had an opportunity to help out the physician that was purchased out of our practice without breaking up our group. Now that's one of the things that I went through with, went from board member to board member, CEO, et cetera, and it did not have to happen, no matter how much it is said that it had to happen. So now you have a patient. We're going down the hall, we see that patient, you know. I've taken care of that patient because I've done 3 stress tests on him. I've done an echocardiogram on him. Jim Whiteside's done the cardiac cath on him, and McConaughey's done the angioplasty on him. You're sitting there as a patient going, you know, I like all my parents in the cardiology world. Who do I choose? What do I do? Then you get this uncomfortable situation where you have one team pitted against the other. I go to Walmart, a patient comes up to me and says, you know, I've been trying to get back to you for the last 6 months, and every time I do that, they tell me I have to stay with this other group. I mean, I hate to say these things, they're a bit uncomfortable to hear, but when the hospital gets in the business of helping to facilitate a split in a group, I want to promise you that it is not in your best interest, and it is not good for continuity of care. I have opened my office door and found a patient that I knew Venkata had seen more than me. And I said, you need to go see him because he knows your case, and I can sit down and get in the middle of it, but you need to go out there and we're going to make you an appointment to see him. Those things shouldn't have to happen. And if you have a captain navigating your team with their finger on the pulse of the community, with their best interest at heart, they will make sure those things do not happen. They will make sure that we're all on the same playing field and that we're all here for a common good. That is my concern about what may happen to this group next. He could be next. He could walk like B. Modi down the hall and see someone from afar that comes up with their hand out and goes, hey doctor, how are you? Well, who are you? I'm the new orthopedist in town. It's already happened to B. Modi. It's happened to us sort of like that. And he might be next. And in a community this size, that kind of thing does not have to happen. It doesn't.
An example I think of that may well be the national trend, and you may well be told you've just got to live with that. But I'd like to think, you know, that old saying, battleships don't make 90-degree turns, but you got a pretty maneuverable vehicle here. That does not have to happen here. It doesn't have to, but it'll take some insistence on your part somebody, to me, has to stand up and say, I'm on the group that's running the ship, and I'm not going to see that. I'm not going to stand for that. And the threatening part, you just are completely at the mercy of it unless you do something. This is a nice thing here, very nice thing. I'm sure that the same sort of thing is happening all the way across the country. There's got to be a lot of small communities that are having this exact same thing happen. I don't know if they're huddled up and meeting, but you've done a pretty progressive thing in coming out here on a Monday night to be a part of this. I hope you will seize the opportunity to finish it. And finish it, by that I mean to get in a group and insist on some changes. You got to.
I do want to make the point, and just to piggyback on to what he just said, so much of the things that have happened have been under the umbrella of the excuse that everybody else is doing it. In my entire existence, I don't think I've ever done anything because everybody else is doing it. I think we have to look at what fits our community. If it doesn't fit, then change it. If we need to take some of the good that's coming down the pipe, incorporate that into some things that already work and don't disturb it. I think we have an opportunity here. If each one of you, as you go out those doors back there, and you see those tables that are going to be now replenished and set up with the forms for you to sign your name on, what we actually envision is that you become a part of those 4 committees, that you volunteer to spend a day of your time, maybe at Barren River Lodge. Barrett and I will spring for lunch, and we would like for you guys to meet with the board members. We're going to ask them in an open letter to our editors, will you just meet our community? Because we can't do it. We're glad to be there and help facilitate. But if you as members will help take ownership in this process, I believe you can make a difference and you can make a change and you can help us become great again. I think you can.
The other part of that question that they answered, will our hospital employed physicians be allowed to participate equally in the consultation arena?
Well, I think they already are. Well, I see what you mean, the ones that are in the offices right now. About 3 months ago, I went down to one of the secretary's offices and said, you know, you got to change this. I do better talking to the secretary than I do just about anybody else. I mean, they seem to listen and they seem to care. And so they said, you know, there's been some talk of that. So I think that we can look forward to some changes made where maybe your physicians will start coming back into your hospitals. I'm hoping at least some of them will. I think that I hear that.
Okay, along that line, why can't some doctors see you if you're in more than one day? The same doctor, if you're in more than one day?
Well, that's the structure of the hospital's program. They work shifts, 7 to 7, I think, and then 7P to 7A. So, you know, they work 2 or 3 shifts on and maybe 2 or 3 shifts off, and that is just part of the uncomfortable nature of a hospital's program. There is not a lot of continuity of care a lot of the time, in my opinion.
Okay, next says, understanding that given the nature of the meeting, most of the questions will address somewhat negative aspects of the hospital. However, in the interest of fairness, could the panel discuss 2 or 3 programs or innovations that have benefited the patient care of our medical community?
Oh, there's lots of good things. I mean, I think that there's more good than bad.
There's primary angioplasty, you know, I think that's something that came along before our group was split up, but I mean, it still serves the community well, and I'm quite proud of that.
I mean, it's not a purpose to sit here and advertise for what we're doing, or really, I mean, we're doing some things orthopedically that we weren't doing a few years ago. Different approaches for hip replacement. We're using, gives you a little speedier recovery. It's beneficial probably for the first 6 months. And if you get to the 6-month point, it probably is no difference than it ever was. But it's a nice addition. It's a nice option to have. I'm not sure that question wants to know things like that, other than, I mean, we're using technology. We had, a few years ago, Dwayne Moss was here, we had, I mean, he came up and told me about something I never even heard of. It drew something called Health Grades, or some computer-driven Medicare quality survey, and we were one of the top in the state at that point on joint replacements. But I don't know if that's the kind of answer you're looking for. But yeah, there are a lot of good things that are going on. I mean, we've got people that care about your well-being, and it's happening just like it was.
Some questions have to do with maybe miscalculations or misdiagnosis. This one says, why will people not admit to a mistake being made when the report and the records show that there has been patient care? What's the process?
Well, there's quality assurance controls in place that are supposed to address those issues. And we know there are a lot of questions relating to things like that. We just thought it would probably be better. That's a general question, but there is a system in place to try to catch those instances and address them. An in-house deal, peer-to-peer sort of thing.
And I think the feeling of the general public, at least from what has been, the past 3 or 4 weeks, I've had a parade of people in and out of my office, Facebook messages, texts, phone calls, visits at my home. And a lot of people in the community do have some concerns about patient care and quality of patient care. And that's a real concern that should not be swept under the rug. It's hard for any human being, I think, to admit they made a mistake. I don't care what it is you're doing for a living. You hate to think you messed up, but we're all human. None of us walk on water, and we all make mistakes. But in the last 21 years that I've been here as a physician, I have found the best thing to do is to sit down and hear what the other person has to say. Many times it's a misunderstanding. Sometimes it could have been done better. So if that's the case, it needs to be said out loud. And everybody needs to arrive at some satisfying answer if it can be arrived at. I mean, we're all human beings. We want to be able to discuss things like that.
A specific question. Husband was sick and called for an appointment with the primary care doctor and was referred to the clinic at Walmart.
I don't know why that would happen, and I think that probably the best thing that should happen is that person should make an appointment to go sit down and talk with that physician and find out why that happened, because sometimes those things happen, and it's just a mistake at the front desk or something. I can't imagine that. I'm sure it happened, but I don't know why it would happen.
We ought to quit. So we ought to kind of wear everybody out. But,
I think you guys are getting tired, and we appreciate it. I mean, we have a million questions up here that we're going to answer, but I implore you that before you leave here tonight, please check those tables out front. Put your name, your email address, a contact number. Let us contact you and let us organize you as committees so that you can sit down and an audience with the board, and maybe you can affect some of these changes for our community. Freddie, you have something else?
Yeah, before that, be addressed. How are the directors of the hospital elected? How long do they serve? Are they paid? And what are the perks? You might need to look at that.
Well, I don't think our board of directors actually get any kind of a salary. I think it's totally voluntary, I think. I mean, there are perks. And there are always perks of being affiliated in the job that you do. I mean, that goes with anything that goes without saying. But I think they meet once per month, and they're not paid. They do get to go on trips together, or maybe one trip together, I'm not sure. And they are not elected, are they, Barren? Or how do you know that?
I think the board appoints people to fill the spots. And I'm sure that headaches outweigh whatever benefits they get. I'm sure of that. But from your perspective, I think you're in